Okay, we're continuing. This is part 5 of the lecture series by me, P. Rogers, on mouth to mitochondria. This is the second part of the section on blood. We stopped last time talking about rouleau formation, which means stack of coins in French, or it's also called blood sludge, whereby there's a bridging molecule with a positive charge on its outer surface, which overcomes the zeta potential of the red blood cell. Zeta potential is a negative charge on the outer surface of the red blood cell and sticks them together. So instead of flowing independently like normally a red blood cell should do, they are stuck together. It's like pushing a submarine sandwich through the capillaries. At baseline, red blood cell 7 microns in diameter, capillary 5 microns in diameter. Okay. Now we're going to talk about leaky gut, and this is a really important thing to talk about. This isn't even in the medical textbook. Can you believe that? That's why I say I can teach a medical student more in 2 hours about what causes the common diseases than they will learn in an entire 4 years of pre-med, 4 years of medical school, and 3 or more years of residency. And that's why I say medical school education is fake. Medical school education is to medical education what public schools are to general education. They're both fake. All right, so here is the gut lining. The gut's called the enteric tract, so the gut lining cells are called enterocytes. Single cell thick. When you eat dietary fiber from plant foods, there's no fiber in animal foods, very little in processed food. It goes to these smiley face good bacteria. They convert it into short chain fatty acids, abbreviated SCFA. Most important one is butyrate, 4-carbon butyrate. It's like a butanoic acid, carboxylic acid with 4 carbons. The enterocytes take that and they make it into tight junctions. The tight junctions connect the enterocytes so that nothing bad can get across them. If you don't eat enough dietary fiber, then you can't make these tight junctions and you get leaky gut and bad things can get across there. But even if you eat enough fiber, if you do these bad things like you drink a lot of alcohol, eat a lot of oily food, glyphosate, non-organic food, a lot of stress, caffeine, emulsifiers in processed food, non-steroidal anti-inflammatory drugs, unfiltered tap water with fluoride and aluminum in it, as well as all these other things that can cause leaky gut. You can still get leaky gut, okay, and it can be bad. And then these bacterial endotoxins get across the gut lining. Also, it's not just the gut lining that uses butyrate to make the tight junctions. Additional butyrate gets into the blood and goes up to the brain, and the blood-brain barrier lining cells, endothelial cells, they also use butyrate to make tight junctions. So what I'm saying is, most of the time when there's leaky gut, there's leaky blood-brain barrier. And if you have head trauma causing leaky blood-brain barrier, it'll cause simultaneously some leaky gut. And that's bad because now when you have leaky gut, this is what I meant by eating a bad diet causing leaky gut. You're like sending fireworks to your brain. The LPS gets into the blood, LPS being lipopolysaccharide, the bacterial, gram-negative bacterial endotoxin, goes up to the brain, and because there's leaky blood-brain barrier, it contacts the brain's outer surface. Then the guard cells rush up there. The microglia are the brain guard cells. They're 10% of brain cells. They're like the sentinel macrophages, and they bind to the LPS. They have something called a toll-like receptor number 4, TLR4. These are called pattern recognition receptors on the outer surface of immune cells that bind to pathogens. So pathogen is like a PAMPS, pathogen-associated molecular pattern. They'll bind to it. So a toll-like receptor is a PRR, pattern recognition receptor for LPS. All right. And then the microglia will now become activated and will release toxic chemicals to sterilize the area. Because as far as the microglia is concerned, bacterial endotoxin, incoming bacterial invasion, must sterilize the area, release toxic chemicals. All right, and those same toxic chemicals will damage the neurons in the vicinity. So that's what I meant by you allow this leaky gut to happen, and you're doing the equivalent of throwing toxins at your brain like those fireworks. And it's worse than that because these bacterial toxins then also have an effect on your blood clotting protein. Gram-negative bacteria produce LPS as their bacterial endotoxin, lipopolysaccharide. Gram-positive bacteria produce lipoteichoic acid, LTA. Both of these things will cause distortion of fibrinogen, the blood clotting protein, from being alpha helix, like a cylinder, like a slinky in shape, to make it change its shape to become flat, like what's called beta-pleated sheet. And beta-pleated sheet's flat like a deck of playing cards, and then the fibrinogen molecules that are beta-pleated sheet configuration can stack up. They stick to each other. The bigger the molecular weight in aqueous solution, the plasma, the blood, the more likely they are to precipitate. To precipitate in blood means to clot. So what am I saying? When you have leaky gut, you form more blood clots. Okay, and these blood clots then travel around. They're typically 2 to 200 microns in diameter, so they're pretty small, but they will plug up your capillaries. Okay, we talked about your capillaries are about 5 microns in diameter, so they're perfect size to plug up your capillaries and other little small arteries. They plug up a lot of arteries in your brain, you get decreased cognitive function. They plug up a lot of little arteries in your heart, you get AFib, eventually you can get congestive heart failure. Not good. Guess what? Most processed food is fortified with iron. Meat has iron in it. People become iron overloaded. Men typically in the Western world in their 20s, women when they're postmenopausal, mid-late 50s. Then the free iron, when you become iron overloaded, I mean your binding proteins like your intracellular ferritin can no longer hang on to it. There's too much of it. It leaks over into the blood, and it will also cause this amyloid clotting. So to change secondary protein structure of fibrinogen from alpha helix to beta pleated sheet is called an amyloid transformation. So these are called amyloid clots. They're difficult to dissolve, difficult to lyse, refractory to thrombolysis. So they're more likely to plug up and keep it plugged, little capillaries and arteries, leading to cognitive decline as well as other damage to the body. Douglas Kell from England, PhD, and Etheresia Pretorius from South Africa are the ones who did the most work on that. They deserve a Nobel Prize, but they'll never get it because big money don't want the pearls knowing about it. Okay, your white blood cell counts will go up. The fat will also have an irritation effect on the neutrophils and cause them to degranulate. Let me show you the consequences. They're called granular cells because they got little granules in them containing in particular something called MPO, myeloperoxidase. I'll show you a better picture of that in a moment here. Okay, so here's your neutrophil, polymorphonuclear leukocyte. They're going to release their granules with these MPOs, myeloperoxidase. The plus sign is because they have a positive charge. A positive charge on an ion is called a cation. You can remember P for positive, P for it purrs like a cat. Anyways, all these positive charges are dropped onto the negatively charged glycocalyx of the arterial lining cells, the endothelial cells, and they cause it to collapse down. Once the endothelium collapses down, remember that mnemonic 600 nanometers thick? They drop down. Now the vascular cell adhesion molecules, the clotting molecules below are exposed, and the white blood cells can bind to them. So the neutrophil will bind to the endothelial glycocalyx, VCAMs, vascular cell adhesion molecules, for example. There's other versions of the adhesion molecules. All right, but the key point is now this is setting up a mechanism where you can get inflammation, and these can eventually pass subendothelial, get below there. All right, but you need to know this. High-fat diets cause neutrophil activation and degranulation with collapse of the glycocalyx and subsequent sticking of white blood cells to the plasma wall, which can lead to blood clotting. It's bad. Okay, now what else can cause the blood to clot? We talk about a high-fat meal, the chylomicrons, triglycerides, LDL cholesterol. Being dehydrated contributes a little bit to this. Having a high hematocrit, like you don't want to take EPO eaten, like some of the long-distance Tour de France bicycle riders used to take. Tobacco leads to elevated hematocrit due to chronic hypoxia. Leaky gut because of LPS and LTA. Being iron overloaded, we talked about that. Elevated serum uric acid, eating too much high fructose corn syrup, for example. Being too sedentary, no exercise. Stressed out. When you're stressed out, you get released into acute phase reactants, and that'll increase your fibrinogen, and it also increases some of your clotting factors, so that makes you more prone to clotting. Sleep deprivation, caffeine raise the same things. They also make your blood more prone to clotting. Drinking alcohol will increase your chance of atherosclerosis. Excess dietary sodium will activate platelets. So what I'm saying is, look how common all this stuff. Very typical that a person will have beer and pizza, which is full of fat, full of sodium, and then they'll maybe have a coffee or a Coca-Cola, all the caffeine, all of this stuff, and then they've often got leaky gut. All of these things are simultaneously creating the increased risk of clotting. Maybe they're dehydrated too. You can see this is all going in a bad direction. Okay, normal blood flow should have what's called a parabolic velocity profile, where the red blood cells are in the center going fastest, then the white blood cells, and then the plasma on the outer surface. Okay, that's normal laminar flow. Okay, so when the blood comes up, it's going to hit the bifurcation points, the median divider. So remember we talked about, here's the internal carotid is my thumb, common carotid is my forearm, internal carotid is my thumb, external carotid is going to my face. So what happens is when the blood comes up, it's going to hit the median divider right here, and it's going to bounce off of that. The more high-fat diet you eat, the more sodium you eat, causing distal vasoconstriction and thick blood from the high fat, the more higher the pressure is going to be, the systolic pressure. So the higher pressure, that's going to bounce off this median divider. And then turbulent flow is chaotic flow. Eddy currents are retrograde flow. The more turbulent flow, the more retrograde eddy currents you get, the more the glycocalyx is going to be sloughed off, and you're going to form clots along the far wall. This is where I always see it. I've seen tens of thousands of these things, these cerebral angiograms and CT angiograms and magnetic resonance angiograms. This is right where the clot forms, okay? Little pieces can break off and cause a stroke. They usually don't, but they can, okay? That's especially your small strokes like amaurosis fugax, okay? All right, now the atherosclerotic plaque is a blood clot, and it can partially be reabsorbed if you minimize dietary fat. The lipid component can reabsorb, the necrotic core can reabsorb, the acute component can reabsorb. The fibrous tissue, for the most part, is not going to reabsorb. The calcium, for the most part, is not going to reabsorb. Okay. If you eat greens, they're going to have nitrates, NO3s on them, and then the bacteria on the tongue convert those to nitrites, NO2s. The stomach converts that to nitric oxide. You get systemic vasodilation. That's why another reason why you don't want fluoride toothpaste, because it kills these bacteria, so you can't make this conversion step from NO3 to NO2. So yes, what I'm saying is correct. You can fluoride toothpaste, fluoride water, fluoride mouthwash. They all can cause hypertension by blocking these nitrate vasodilator precursors. Proton pump inhibitors, wiping out stomach acid, can do it as well as antacids, okay? Because then you won't get the conversion step from nitrite, NO2, to nitric oxide, NO. And that's the exogenous source. Okay, I think we'll stop right there, and then I'll finish it all up with the next one. But I think you're getting the point by now if you haven't studied before. There's a lot going on in the blood, and high-fat diets make it worse. High-sodium diets make it worse.